Contraception, informational, commercial, topic, contraceptive patch, part 3. How does this form of contraceptive work? Releases hormones and estrogen and progesterone to prevent the egg from leaving the ovaries. Thickens the cervical mucus to prevent sperm cells from fertilizing the egg. How do you use it? First thing is first, see your physician to see when is the best time for you to start using the patch or if it's a good form method of contraception. Stick a new patch on your buttocks, upper arm area, stomach, or back every week for 3 weeks in a row. For the 4th week, you use no patch. The first day you put on the patch is your patch change day. That means that you put the patch on those Tuesdays. Every Tuesday for 3 weeks, you put on a brand new patch. The 4th week, you'll leave it blank and start again with patch, 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 blank, patch, 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 blank. How do you use it step by step? Pretty much what you do is take the patch out of the wrapping, give it the foil thin, and then you place it on any of the previous mentioned areas and hold it with your palm for 10 seconds. Then check your patch every day to make sure that it's still in place, avoiding lotion, oil, makeup, or powder around the patch so it doesn't become big. After a week, you remove the old patch and apply a new one. When you take the old one out, you fold the patch in half so that the hormone will not get into the soil and water supply. What is the failure rate? Less than 1 out of 100 women get pregnant a year when using the patch 100% correctly. 9 out of 100 women get pregnant a year when not using the patch as directed. May be less effective for women who weigh over 198 pounds, but still is a good option for all women. Talk to your provider. Medicines and supplements that can make the patch less effective is antibiotics like flampin, anti-seasonal Gracefulvin, HIV medication, some anti-seizure medicine, and St. John's wort. How much does it cost? The Ortho River patch is only available through a prescription. If you need a pelvic exam before receiving the contraceptive patch, it will cost about $35 to $250. The patch itself can be purchased with a prescription at a drugstore or clinic. 1 month supply costs about $15 to $80. If you have a family pack, a little green card from your health center or Planned Parenthood, your prescription and exam is advantages and positive side effects of the patch. Simple, safe, and convenient. It makes your periods regular, lighter, and shorter. It has the ability to get for you to get pregnant returns quickly than other birth control. It protects against acne, back cramps, bone thinning, breast growth unrelated to cancer, ectopic pregnancy, endometrial and ovarian cancer, infections in ovaries, uterus, tubes, iron deficiency anemia, cysts in the breast and ovaries, pelvic inflammatory disease, and premenstrual symptoms. Disadvantages and negative side effects for short-term effects: there's bleeding, breast tenderness, and nausea and vomiting. The bleeding is between your periods, and after 2 to 3 months, those side effects should stop. The long-term effects is change in your sexual desire and rash or irritation wherever you put the patch on your skin. It's important that you find a method that won't make you feel sick or uncomfortable. So if you continue to experience these side effects after 2 to 3 months, talk to your physician. After you stop taking the patch, it should take about 2 to 3 months for your periods to return to the normal cycle that it was before. If once in a while there are women who have irregular periods or absent periods, and that's from periods that were irregular periods during before you had started using the patch. Serious side effects, even though the risk of the hormones they're normal of taking birth control with hormones. Um, the serious side effects don't occur that often, but some of them are heart attack, stroke, blood clots in your legs, lungs, brains, and heart. Those are a higher risk for the patch than the regular pills or any other birth control. High blood pressure, live tumors, gallstones, and the yellowing of skin or eyes. And these rare risks include developing. These risks can increase for people who are 35 and older, overweight, have certain inherited blood clot disorders, diabetes, high blood pressure on its own, high cholesterol, prolonged bed rest, and who smoke. They also have warning signs. So if you have any kind of warning signs, such as a lump on your breast, headaches, achy soreness in your leg, back pain, bad headaches, pain on your abdominal or chest, and other types of warning signs, report them to your physician so that they can check on it as soon as possible. Does it protect against sexually transmitted infections? It does not protect against sexually transmitted diseases or infections. You use condoms to protect yourself and your partner from the STIs, and you should be safe.